Hi, my name is Mark Fulcher, and it's my pleasure to introduce Dr. Dan Exeter in this 11 in 11 talk. Dan is a sport and exercise medicine physician based at the FIFA Medical Centre of Excellence in Auckland, New Zealand, and he's going to share his experiences working with young athletes and talk a little bit about early specialisation. So thank you very much for joining us, Dan.
Thanks, Mark. Good to be here.
So Dan, I guess if you could start by maybe just telling us a little bit about what early specialisation is and how it's come about and what the implications are for young players.
Yeah, look, early specialisation is broadly defined as intensive year-round training in a single sport at the exclusion of other sports. And later in the talk, we'll come to three key parameters that can be used to stratify that degree of specialisation. But that's the definition that most people tend to use. Within that, as we discussed, there are a few ways to stratify that. And I think we'll come to that later on. Mm-hmm. And it talks about how, therefore, you can put an athlete into a box to say that they are low specialised, moderately specialised, or highly specialised. And there's some tools that people have been able to use to do some research in this interesting area.
Okay, and why are we interested in specialisation?
Well, it's happening more and more, and we're seeing more and more young children. When we're saying young, we're talking about kids before the age of 12 to 13 starting to focus on one sport at the expense of others. And it's come about because there's some misinformation, and what we're also seeing is some of the downsides of taking that approach.
Okay.
If we look at some key sports where it was thought that early specialisation might be helpful, we look at sports like rhythmic gymnastics and diving. But it's really interesting because even if you delve into those sports, there's very little evidence to suggest that early specialisation is beneficial. And it's only really been shown in one small study of rhythmic gymnastics. And if you look at those sports, they're very, very different to football. They're sports where we're being successful before full physical maturation is important. They tend to be technique-based sports with an aesthetic component. It's very, very different to football. So it's very difficult to see how this approach could be applicable. It's certainly not transferable from an evidence point of view. And what we've sort of seen is that as that has sort of bubbled to the surface, we've had a couple of key reasons on a day-to-day level why kids are specialising more and more. And it often comes down to an interaction between parents and coaches. So what we see is that the parents will often be the ones to initiate early specialisation. They're the ones who might push a child in a particular direction. But it's actually then the coaches who have the ability to ramp up that training intensity and to reinforce that message. So it's a bit of a key in the lock scenario. You need both to generally see this develop. And the coach might have other reasons why they want the athlete to be early specialised. We'd like to think parents have got their kids' best interest at heart, but they're often not really aware of the upsides or lack thereof, and so the significant downsides of making their 10, 11 or 12-year-old focus on one sport, or in this case, football.
So do you think parents want their kids to be the next Lionel Messi or Cristiano Ronaldo?
Yeah, and I think they just generally subscribe to more is better, and they get these opportunities thrown at them, academies and training camps and that sort of thing, and they see that as an opportunity for their child to do something, and they also get a bit concerned that they don't want to deny their child those opportunities, and it becomes a bit of a vicious cycle. And it's come off the back of a couple of things that have become quite topical again. And the first is this concept of 10,000 hours, which was a concept raised by Ericsson back in 1993. And Ericsson essentially said that you needed 10,000 hours of practice in any given area to become an expert. But it was actually something shown in musicians. It's never been applicable to athletics or athletic-based pursuits. He could show that 10,000 hours of training for a musician meant that someone was more likely to become a maestro than someone who needed 7,000 hours. But but that's never been shown to work in sport. And then that concept got picked up and run with, I guess, by authors such as Malcolm Gladwell in his book Outliers, where he talks about how do you get to success and raises this 10,000 hours concept again. So you get this perfect storm where it becomes very topical and parents latch onto that. Coaches then facilitate that process, and next thing you know, we've got a problem with young kids doing too much of one sport too often. And so what I think is really interesting is that people are doing this because they think it's the right thing to do. They think it's going to make their child or their athlete better at football, is to stick to football early. But not only does the evidence not show that that's the case, the evidence potentially shows that you're actually better off to play a number of sports when you're younger. So if you want to be successful in one sport, it may actually be better to have a broad range of sports when you're younger. And there's certainly a couple of studies out of Denmark and one out of Germany that shows in some of the Olympic sports that people were more likely to get to the elite level rather than just be sub-elite if they had a broader range of sporting pursuits. And if you look at some of the sports that are talked about in those studies, we see sports like tennis, rowing, track and field, cycling, skiing. So sports that are probably more similar to football. They're not ball sports, of course, but very different to those other sports that were very much aesthetic and where peaking before physical maturation might be important for that sport. So potentially what we should be saying is if you really want to be successful, forget this early specialisation, actually stay broad, and then once you get into your mid-teens, then pursue football is at a more exclusive level.
So we're talking generally about early specialisation. We're seeing more kids playing more football than perhaps ever before. And perhaps if we're trying to develop players, it sounds like that may not be the best way to develop players. I think you're going to talk a little bit more about some of the risks or problems associated with early specialising.
Yeah, that's right, Mark. So look, we've already shown that there's no real upside to doing it, certainly in a sport like football. There's actually quite significant downside, and this is a nice slide that talks about the three key questions that some researchers from the United States, and I've got to give credit to Jayanthy and colleagues here for some excellent work. There's some three key questions that they've used to risk stratify a degree of specialisation. Does a athlete train more than 8 months of the year? Do they choose a main single sport? And the question that really discriminates between moderate and high risk specialisation: do they quit other sports to focus solely on that sport? And what they've been able to show is that kids who get overuse injuries are more likely to be in that high specialised group. So that is answering yes to all three questions. You answer yes to all three questions, you're highly specialised. If you answer yes to two, then you're in a much lower or more moderate risk. And if you answer yes to none or one, then again that's even lower risk. So if you're answering yes to all three questions, then we know that you're more at risk of overuse injuries. And the odds ratios there range from 2 to 3 with respect to lower limb injuries. So it's reasonably relevant.
So we've got 0 to 1 is low risk, 2 is a moderate risk, and 3 is a high risk.
That's correct, yeah.
We've done well with that slide, haven't we?
The other thing to look at is just overall training hours. And this is another great graph which shows that you can put a line of best fit really through increasing hours per week of training, and watch that with a nice curve marry up to the injury risk odds ratio. But as soon as you jump over 16 hours a week, that risk of injury doesn't fit that curve. It jumps ahead rather rapidly. And there's some nice research in 2008 that's been able to demonstrate that playing more than 16 hours of a sport when you're young puts you at risk of overuse injuries, and there's a positive correlation there. The other thing I guess to talk about is this concept of burnout, and I think we're increasingly aware of the importance of the mental health of our athletes, and just the reason that we want kids to play sport and to play football is because we want them to enjoy it. And this is a good position statement from the American Medical Society for Sports Medicine. And it shows early specialisations associated with some things that are really not what we want to associate with sport. We know that early specialisations associated with spending less time on national teams, deciding to quit sport earlier, enjoying sport less, which is just a thing we really want to try to avoid, and actually lower health outcomes. So if you look at some of the broader implications of early specialisation beyond injury, it also could be detrimental in other areas as well. So just more and more we're seeing that this is just not the right way to go, not only if you want to be successful in the sport, but actually if you want to enjoy sport and avoid injury.
So I guess what we're hearing is that early specialisation potentially doesn't make you into a better player. There's an increased risk of injury if you're playing more, and you're less likely to enjoy the sport and participate lifelong if you specialise too early.
Yeah.
So have you got any sort of specific advice for when we see that player come into our rooms, or we see those parents, what can we talk to them about?
These are the three key parameters I look for, and I make young footballers total up their training and game hours each week when I ask them questions about how much they do, and it's particularly relevant where we're from, Mark, in that we've got players often playing for a number of different organisations, club, school, academy, for example. So the three key issues, or the three key parameters that put you at risk of overuse injury, is greater than 16 hours a week of training or gameplay, a ratio of organised sport to free play, or just play, which is greater than 2-to-1. So if you're spending more than double the amount of hours that you're just running around having a good time as a kid in organised sport, that also puts you at risk of injury. And a nice, really simple one, if the number of hours you spend in organised sport is greater than your age, that's a very, very simple one. People know how old their kids are, and if you're spending more time than that training or playing, you've got an increased risk of injury. And so there are things I try to disseminate to everyone I deal with, coaches, athletes, parents, other health providers, because they're nice and simple and we can all ask them.
Yeah, there's some great take-home messages or take-home tips that we can all use in our practices on Monday.
So look, that's really the gist of it. I think what we've been able to show today, Mark, is that early specialisation was never really intended for sports like football. There's no evidence base to support it. Not only does it not make you more likely to be successful, it potentially makes you less likely to be successful. You may be better off to be broadly involved in sport and then specialise. And finally, it puts you at risk of injury, burnout, not enjoying sport. And that's those are things that we just don't want our young athletes to be exposed to. We want them to be able to enjoy football, and if they're successful on top of that, then that's an added bonus.
Great. So look, thanks very much, Dan, for that excellent summary of what is a very interesting and kind of topical topic. One of the key things with the 1111 is the opportunity for our network users to interact with our experts. And so for those of you listening who may want to pose a question to one of our experts in the future, log on to the groups and have a look to see who is going to be speaking next and how you can ask them a question. We do have a few questions for Dan today. So from the network, we have a question: at what age does it become appropriate to start specialising?
Yes, we talk about early specialisation being those parameters we talked about before, occurring before the ages of 12 to 13. So really it's about 14, 15 you can start to choose one sport over the other. So when you really come into that post-pubertal adolescence period, that's when you can start to focus on one sport.
Very good. The next question is about biobending. I've heard about biobending. What is this?
I might keep you on your toes here, Mark, because you know a fair bit more about biobending than I do with a lot of your work in football. Why don't you explain that one?
So in general, so a nice way to think about it is the average 13 or 14-year-old And we know that the average is not what all 13 or 14-year-olds look like. So for any given age, we could have a 6-foot tall player and we could have a 4'5" tall player. And so obviously there's chronological age, but there's also physiological age. So what does the player look like? How close to skeletal maturity are they? And biobanding is essentially a way of trying to group kids together by their physiological age and by maturity rather than by their age. So looking at their parents' height, looking at rates of growth and development, and using some other measures in a formula to try and estimate their physiological age rather than their chronological age. So biobanding is something trying to group players together so that they're more on an even playing field. So it's something I think that we're going to see more of, and it is a way I think of trying to prevent some of these overuse injuries you're talking about. Next question. In our country, the best young players often play for multiple teams. Do you think that this is a problem?
Potentially. And the reason it's a problem is it's very, very easy to start to exceed the training parameters we talked about before. So if you have a scenario where a player or a footballer has to play for their school, plays for their club, and then has academy commitments, you can see very quickly that by having 2 trainings in a game for each of those 3 organisations, it'd be very easy to exceed 16 hours per week of training. It'd be easy to exceed a organised sport to free play ratio of 2 to 1. And if you total up those hours, it would be very easy to be doing more training than your chronological age. And the other thing is that kids who tend to be good enough to be involved in multiple teams, all those teams want a piece of them. And Team A is not talking to Team B or Team C about the overall load for that young athlete. And no one has ultimate responsibility, and they're often very good. So each of those organisations wants that kid to be playing for them. And so a bit of oversight is really helpful. You like the parents to play that role, but often they feel a bit subservient, I guess. They feel that they aren't empowered enough to confront someone and say, I think my child's training too much. Again, for all the reasons we talked about before, they want their kids to be successful. They don't want anything to stand in the way, and they think this is the right way to do it. They've got their kids' best intentions at heart.
Okay, well, thank you very much, Dan, for what's been an excellent talk. I think for those of you listening, if you have any questions or this has stimulated your thinking, please feel free to log on to the network and interact with your peers and some of the experts. So thank you again, Dan.
Thanks, Mark.